And I did have a second opinion on the video where everybody's looking at your head.
I told you.
I know. I go, Steph, she goes, oh, I like the Zoom ones better. I go, I know. She's like, I go, some of them. I go, yeah, I kind of do too in some scenarios. I said, there's lots of different ways we've done it. I said, listen, Levi knows how to get the social media. And then there's some people that want to see that Zoom view. I said, she goes, well, what's with that? Like, I go, I did yell at him for the bald head view. She goes, yeah, it looks weird. I go, well, he's trying to do like a behind the scenes, bring the reader in thing.
Yeah, I'm trying to make it where...
And we're in a shitty office.
I'm a producer.
You're a producer.
I'm not the...
You're not the star of the show.
Hi, this is Unlimited Access. My name is Levi.
Hi, Shannon Aylesworth.
And today we're going to talk about patient nudging. All right, so patient nudging. So Fred, a guy on our team, did some really good work. He was participating in a panel, and that was one of the many topics that were on this panel. So we'll, be able to give you a link to so you can see the whole video about him talking about this. But so patient engagement is a big challenge, right? So this idea, we've talked about it before, the idea that patients are passive, right? Not assertive in their own health. And this idea of patient engagement, like taking ownership of their own health. And then this idea of, oh, well, sometimes we just forget, right? We just forget, and we need to get a little nudge, a little poke, a little reminder. Is that the way? Yeah, that's the way I'm looking at it.
Yeah, it's that. It's a combination of, polychronic is the term we're going to say a lot. Multiple chronic illnesses.
Right, so diabetes, heart disease,
kidney disease.
Exactly.
It's less that they don't want to. It's that you often don't know where to go, and so you're stuck trying to figure out what you do next. Personally, my neck has been killing me for 3 months. I called my chiro. It didn't solve the problem. I don't know where to go next. We're all looking for guidance. And when you don't have it, you just stop. So patient nudging, the idea behind that is, we call it in our app notifications. But in the medical space, we say it's like a poke. We were just saying that before we started. Like Facebook, hey, poke, I asked you a question. Poke, I asked you a question. Hey, did you get your appointment going? Because patients do get overwhelmed with the amount of information. Everybody, patients, providers are overwhelmed with the amount of information that's coming at them at this point because of this rise in chronic illnesses and how much you have to manage it regularly. And really managing chronic illnesses effectively is about proactive management. So if somebody doesn't know that, they don't know that they're going sideways. Listen, it's not till you're sitting in your doctor and you all of a sudden you're like, oh, yeah, that makes sense now. But at the time that you're feeling it, you don't. So the doctors want to get in front of that. They want to understand how to, hey, how do you feel today? So there's another term that goes along with it, which is patient reported outcomes. And we're actually building this in, which is like, poke the patient. Hey, how do you feel? I sent you home with these meds. How do you feel? Do you feel good? Do you feel bad? Can you do a quick survey? Let us know. Because not only do you feel like you've got help from your doctor's looking out for you. The way it's being handled now is you get a phone call from your nurse or whatever. You don't really know what they're calling you about. And they're like, hey, I'm just checking in. Well, it's weird. We're like, first of all, I don't have time to call back. And okay, about what? But they can't communicate any of that because it's HIPAA controlled and whatever. So it's patient nudging is how do we get the patient help? And how do we keep them focused on what we need them focused on? Give us enough feedback as a medical community to give you help where you need it. You might not know where that is. I mean, listen, people ask like, I don't know what to do with my back next. I don't know. I could end up in surgery next month because I am continuing to destroy my posture.
I think about patient nudging very similar to like the text messages I get from you. Like, Levi, did you get that video done yet?
Yeah, that's exactly what it is. Hey, any chance that's done?
Yeah, of course it is.
Hey, a good one is, hey, do you have hey, what's your list of priorities this week? That's a nice nudge. Trying to figure out where is that video in the list. Hey, would you be Ubering today?
Yes, I will be.
Okay. So I guess my video is not getting done. totally the same idea. But in a patient perspective, you know that they're exhausted and tired. So sometimes you can poke the caregiver and say, hey, like I get all the time, hey, that's why they call me, you know.
You do it nicely, like a physician would.
The bad term is, you know, the warden is
nagging.
Yeah, it's nagging. That's why my doctor said.
So patient
my
nudging.
Dad's doctor called it me the warden, and he's like, I'm like, no, but I'm the one who said he fell 7 times in the last month. He's not okay. Is there anything that's changed? Oh yeah, actually, you know what? It has, because intervention in chronic illness management is like the number one thing. How do you intervene before they go south? Because that's when it just spirals.
Right. And it seems to me like there's a lot of that. I'm going to go way back here, but you know, obviously there's environmental things that cause cancer, right? So
yeah,
smoking. So nudging on a big scale would be like, let's stop smoking as a society, right? And then there's like, eating habits, personal, right? If I don't go through the McDonald's drive-through every day, I probably won't have as much, you know, bad health implications, right? Or whatever the right word is there.
Yeah.
So there's that. But then once you have that polychronic environment, we still need that nudging. Okay. So maybe
it's even more specific. It now becomes more specific, right? Unfortunately, as a society, yes, fast food became big. Oleo became big, right? All this.
The whole box of Oreo cookies.
The whole box of Oreo cookies. Like, this is all stuff we all know. They're not talking about nudging you on stuff you know.
Right.
Everybody knows when they pick up a cigarette at this point. If you don't know, vaping caught everybody off guard because they thought that was good, okay? Once it's out there, you know. It's more like, hey, you have a chronic kidney problem. This food, there's a diet called the FODMAP diet. Chronic illnesses get worse from inflammation. Inflammation is caused by nutrition choices. So what you may not know is that the yolk in an egg, you're not allergic to it. It causes inflammation, which impacts your chronic illness. So it's more about like, hey, based on your particular health situation, we're going to poke, hey, what's going on with your nutrition? We're not judging you if you decided to eat McDonald's. That's your choice. We are wanting to make sure, do you know, hey, did that broccoli bother you? Like, I've recently found out that carrots bother me, and I'm like, they make my eyes itch. Like, it's so weird. And so I started Googling. Well, it turns out it lands on the FODMAP diet of things that cause inflammation. So yeah, so it's really much more specific, especially that's why they want it to sound kind. We're not poking you. We're not reminding you to be
nagging.
Yeah. Well, it shouldn't be perceived as, hey, we're your mother. We're not trying to be your mother. We're trying to help you get help. And that's where getting the right people who want to engage is important. Is, do you want to have a good quality of life? Education. To have a good quality of life is education on nutrition and things. And every day people are learning, because every day people are learning. So how do you get that medical knowledge out to the
right? And that's that was what I was getting at, I think, in my Levi non-expert way, is like this idea of like, we as humans, for patient engagement, we need to take more responsibility for our health. And we kind of know some things. Smoking is bad, right? But there are certain things that we need to engage with our physicians, with our care team, to make sure that we understand the implications of it. And that occasional touch is going to save us so much down the road. Right. It's going to prevent us from going to the ER, or prevent us from having like long-term care things that we're going to need we'll be able to be involved and be engaged there.
Yeah.
So,
yep.
Well, thank you so much. Do you have anything else on that subject? Fred, we're going to get you on the pod.
No, listen, I love that. I was writing because I'm like to Rachel, like, hey, shout out to Rachel, nudging and notifications and making sure people understand why that's valuable from a medical perspective. So no, I thought that we will send you the link to Fred's. He actually organized that with Modus, and it's I'll tell you, it is a content rich hour. I was really astounded at how much, I mean, just the people alone, the experts, Amy Butcher and Secretary Shulkin and the group that he had, but just really great information. So if you have a chance, we'll include it in our link and take a look.
Well, thank you so much. Well, here at Ursamin, we believe patients, people, caregivers, the doctors, physicians, nurses, everybody in that patient care community make better decisions when they have access to all of that information. And thank you so much.
Thank you so much.
Bye.
Bye.